Good morning to all of you therapists, except for you therapists who think that everything is trauma. Yep, that was an actual post made by a CBT therapist on Twitter in December of 2022. And it's a criticism that I'm used to having lobbed at me at this point in my career, especially from therapists who are more academic and usually more cognitively academic. This idea that you're all taking it too far by saying that everything is trauma. But are we taking it too far? The English word trauma simply comes from the Greek word meaning wound. And this is a metaphor that I've really leaned into in helping me better understand trauma. The working definition I give as both a complex trauma survivor and as a clinical professional of trauma is it is any unhealed human wound. Yes, some wounds can qualitatively be more serious than others. Some may require more significant treatment than others. Some wounds compound on top of other wounds, if you're following this metaphor. Some wounds may lead you to a DSM diagnosis of PTSD or another trauma or stress-related disorder. And unfortunately, this is what I feel that a lot of folks who approach this more cognitively will label as real trauma or significant trauma. And this labeling of real trauma to me is very dangerous because so many childhood trauma survivors have been made to feel at one point or another that, what I'm going through isn't that bad. Hell, a lot of abusers use that line. You don't know how good you have it. And so to be out there in kind of the public psychology space and hearing other therapists, or you may have even had a therapist use language like, well, is this really trauma or was it just something bad that happened to you in life? That can be very minimizing and can keep a lot of us from feeling stuck about even addressing the work we need to address. So is trauma getting overlabeled? I don't know, but all I would say is I would rather it be overlabeled and discussed than underlabeled and minimized. Your wounds, whatever they may be, however they show up, are worthy of attention, are worthy of treatment, and yes, you have choices in how you go about having those wounds treated. I'm not here to disparage all the different types of therapies that are out there, but I do want you to know that if you feel trauma is a factor for you, it probably is. We see you and we encourage your right to have those wounds healed.